they're pretty straightforward. It's end of life care, uh, trauma prevention, lifestyle, alcohol, tobacco, drugs, obesity, and dealing with mental health issues. And if we just put a significantly more resources just targeted into each of those, you're not going to solve everything, but we could decompress a lot of the healthcare problems, reduce costs, and have people be happier and more functioning.
Absolutely. Dan, are we going in the right direction? I mean, you spent 24 years as a Maryland state legislator. I counted about 46 different committees and commissions, many of which you led over the last 24 years you were in the legislature. So there's nobody that's closer than you to what's going on behind the scenes in regard to regulation. Is regulation, two questions, please. Is regulation the way we need to go to make significant change for health equity? That's the first question. The second question, please, is if that was yes, that's the way we go. Are we going in that direction? Do you see progress?
Yes, and yes, but it goes along at a snail's pace, and it's very hard to get things done. But let me share an anecdote. Way back in 1995, my first legislative session, there was a bill, and there I was a freshman legislator, new to everything, a newbie, trying to navigate my way around the place, and meet people. I there was a very controversial bill. I would walk down the hall and someone would come up to me and say, Delegate Morhaim, you need to vote for this bill. It's the most important health care bill, save lives, so forth and so on. Go down a little farther, and somebody up would come to me and say, Delegate Morhaim, you need to vote against this bill. It'll destroy the Maryland economy, throw thousands of people out of work. And this continued for months. What was the bill? The bill was to ban smoking in restaurants. It was controversial. It was hard fought. We finally passed it. Civilization did not collapse in Maryland as a result of that. In fact, business went up in restaurants. It took 10 years to ban smoking in bars. Went through the same fight. And now we look back and say, we were fighting about that? What was the fuss about? And that's something I've seen over and over again. You have to keep pushing on all the issues and hope that there's some progress along the way. We've made some, but it's often 2 steps forward, 1 step back. And the equity issue is really important because there's certainly an element of politics in which the people who have the power continue to leverage their power in their interests. Hopefully, over time, we make progress on all these issues. To me, the core equity issues are advanced care planning and the complete failure of the policy known as the war on drugs. After 50 or 60 years of that, which has certainly hit the minority communities and poorer communities much harder, we don't have one statistic that's even better. Now, I'm not for substance abuse, but putting people in jail, criminalizing everybody, is clearly not working because there's more overdose deaths, more disease, more crime, more violence, more money, and it's global. It's not just here in Maryland because it's a gigantic global system. And so I put in bills to support addiction treatment way back when, and put in bills to decriminalize possession of small amounts of drugs. I could just see it was absolutely not working. In fact, I was the first state legislator in the United States to put in a bill to decriminalize possession of small amounts of drugs, not saddling people with a criminal penalty that branded them for the rest of their lives, but rather give them a very modest civil penalty and a referral to treatment.
You talked about
that's still a struggle. That's still a struggle. It hasn't happened yet.
Yeah, you've been talking about that for 20 years. In fact, an article you wrote just last year, you quoted what happened in 1970, and you stated in 1970, the war on drugs that you're talking about right now was escalated by none other than the President Richard Nixon. In 1994, right, 24 years later, his advisor, John Ehrlichman, he actually said this, right?
Yes,
Nixon,
it's a quote.
It's actual. This is astounding. He said the Nixon campaign in 1968 and the Nixon White House after that had 2 enemies: the anti-war left and black people. We knew we couldn't make it illegal to be either against war or the blacks. But by getting the public to associate hippies with marijuana and blacks with heroin, this is in print, and then criminalizing both heavily, we could disrupt these communities. He goes on to say we could arrest their leaders, raid their homes, break up their marriages, and vilify them night after night on the evening news. Did we know we were lying about the drugs? Ehrlichman says, of course we did. It's astounding. Absolutely astounding. So
Well,
is that
totally cynical policy, and it worked. I mean, Ehrlichman went to jail for Watergate crimes, and this was after when he gave this interview to Harper's Magazine, and that quote is right from that magazine. And yeah, that policy worked. So millions of people went to jail. They were disenfranchised. They couldn't vote. They were, had the stigma of a drug conviction, which made it impossible for them to get employment, education, housing, credit, whatever, the things that we all normally need to live in this society. And that's fueled homelessness. It fueled all kinds of other problems. And it continues to this day because we still haven't done anything particularly creative on drug policy.
And so, Dan, let's fast forward. Here we are, 2019, COVID epidemic. And what do we say to these communities that we disrupted, that we broke up their homes, and we vilified night after night on the evening news? We say to these communities, hey, trust us, take this vaccine, you'll be fine. And we wonder, Dan, we wonder why they don't take the vaccine. And we wonder why they're not taking advice.
Well, they're not the only groups that were skeptical about vaccines, but a lot of, I guess, far-right folks were very skeptical as well and refused. And some statistics show that the folks that refuse vaccines have worse COVID cases and more deaths. But, that's a whole issue of trust and being honest. But without having to get into that whole complicated psychological, political issue that's going on now, there's still basic things that can be done that would move the needle forward. So that's what I keep trying to do. I mean, for advanced care planning, there's free legal forms around since 1991 called advanced directives. It empowers people, whatever your persuasion or wishes are, whatever stage of life, and yet fewer than half Americans take advantage of that and complete these forms. It'll be very helpful to have one of the few things in healthcare where you can make your wishes known in advance. We're all mortal. We're all going to face this. And you don't know what's going to happen when you're 18 or 28, 58, 98. So, this is a simple thing. Now, talking about death and dying was always a challenge to me as a politician, because I would bring it up at community meetings and at the gym and at the grocery store whenever I run into constituents, and other people say, what are you, Dr. Doom? People aren't going to vote for, they want politicians to be happy things.